I grew up in a very small community and recognized sometimes the struggles with access to care. And as I progressed in my training, my wife and I kind of started looking at areas where we wanted to really raise our family. And we've worked in really big locations, New York and Southern California, and we really just, even though we enjoyed all of those locations, we wanted to raise our children in a smaller area. And so that's what drew us back to a smaller community and a rural, perhaps even underserved community. Oh, they're great, right? The people here are the salt of the earth. They work very hard. And a lot of that work oftentimes results in wear and tear on their bodies that causes pain. And so I'm happy and privileged to be able to aid them with their pain so they can continue doing the things that they enjoy doing. I've been in Richfield for 6 years. I cover all of central Utah, so I have a satellite office in Mount Pleasant up in Sanpete County and as well as in Wayne County. So we really cover 3 offices in our central Utah location. Well, I was not always going to go into medicine. One time I was planning to become a veterinary physician, work with animals. But I learned pretty early during early training time that wasn't what I wanted to pursue. I very much liked working with people and sharing their struggles and difficulties health-wise with them and trying to come up with solutions that would improve their quality of life. It's really important to discover what's causing pain because by far the vast majority of pain can be treated. It can be understood and treated, right? We can really get to the bottom of what's causing the pain and then have great treatment tools available to help. The notion that you just have to grin and bear it, is oftentimes viewed as very stoic or somehow praiseworthy. And being able to tolerate some degree of pain, I think, is important for human nature in general. But when pain becomes limiting, when we're planning our life around pain, that's problematic. Well, there are a lot of reasons that people experience pain, all the way from really anatomic issues that result in pain, wear and tear, different medical conditions that are considered painful. And a lot of times, medicine is very good about treating illnesses and treating conditions and treating syndromes and those types of medical problems. A lot of times the symptom of pain is overlooked, and the reason it's overlooked is a lot of people just don't know what to do with it. Pain rarely takes an individual's life, and we're really fortunate in that aspect, but what it does is it takes their quality of life. So, somebody who's miserable with pain isn't able to enjoy or participate in life in the way that's meaningful to them. And so with the tools that we have and the training that we have, the Southwest Spine and Pain, we're really able to offer people different treatment options to improve their quality of life.